Welcome back. As County Mayor Carlos Jimenez is pushing forward with a plan to lessen restrictions during the pandemic here in Miami-Dade County, Dan Gelber, the mayor of Miami Beach, is taking a more cautious approach.
We're going to go a little bit slower than the county, which is actually opening up Monday. We want to make sure that our retail has enough time to prepare in our restaurants. So we will begin with retail and general business on Wednesday the 20th at this point. Assuming that we can get all of that in place, the following Wednesday we will be starting with restaurants at some limited capacity and perhaps with expansive outdoor seating.
Let's talk a little bit more about restaurants. So what are the rules that are going to be governing restaurants when they have a chance to start reopening?
We're going to try to have very vigorous testing with employees. There'll be masks. Obviously, social distancing is going to be in effect. And the capacity, while it may be 50%, the real limiting amount will be the 6 feet. We're going to be very careful about that. We're going out, we have 800 restaurants, but our intention is to get out to all of them in some way to make sure they understand the rules, because the worst thing is that we have hundreds of restaurants opening and not understanding what they're supposed to be doing. I mean, this is not a green light to everything is over. We are at the end of the beginning, but not anywhere near the end of this thing. So we're doing this in a loosening kind of way, but not any kind of, open season ongoing and dining.
Has Miami Beach actually met what the standards would be for entering phase one as the White House originally envisioned it? Does Dade County meet those standards?
Here are the standards, Jim. Number one is you've got to have this trajectory in positive cases and a number of cases. We've also added hospitalizations because we think that's pretty important. There has been a downward trajectory for 2 weeks. Not a steep downward, and the reason I say that is there's still virus in the community. It's not like it's bottomed out. It's clearly still here, which brings me to the second point, which is you have enough of the contact tracing so you can go back to infected people and figure out who they've infected and get quarantining of people so that you can manage the virus and its impact. And I think that the Department of Health says they're already close to 300, probably need more than that, but they also are about to get more people. And the Rockefeller Foundation, we asked that they come in, and they are actually also providing resources and expertise, so that would be very helpful. The last thing we want to do is become a depot for the virus, where people come to our restaurants or come to a venue or Lincoln Road or Ocean Drive and leave ill. So we're very, very aware of the challenge this has, because what people have to know is that more than anything, we cannot have crowds. We cannot, this social distancing requirement remains. While you've got to have a downward trajectory and you've got to have the contact tracing, you still need to exercise social distancing. That is in the CDC requirements, and it's obvious we need to do it. But we cannot have a repeat of what happened during spring break at the beginning of March.
You didn't mention beaches. Beaches is another major draw to come over to Miami Beach. As I understand it right now, you're not close to opening the beaches. Talk to me through what your criteria is going to be before you start to open the beaches themselves.
Well, I think our manager and our commission have understand this, and I feel this way. Before June, I think would be a mistake. And it's not because beaches intrinsically spread the virus, it's because crowds come to beaches. And we've seen what happened in Naples, we've seen what happened in California. You open up beaches and there's a rush there. And we know that our beach is one of the most beautiful in the world. It's entirely public. So it's 7.5 miles of beach, and anybody can go there. We can't say it's just for residents. We can't do that by law, and we can't limit who's there. And trying to even enforce a couple hours a day in the morning would be very difficult when you think about 7.5 miles of beach. And of course, the southern part is on Ocean Drive, and the restaurants there are going to be opening up likely in the street in a couple weeks. So if we see crowds, then we have done something we have to stop. We'll have to curtail it, and it's hard for us because, I say this, and I don't mean it in a kidding way, but to a great extent, hospitality community is a crowd-based business. It's not something where you want just a few people. You generally market yourself to get crowds. It's really a crowd-based economy. Lincoln Road has pretty high rents, but if they get a lot of consumers, they're able to pay those rents. Well, we don't want crowds on Lincoln Road. So what's going to happen there? We don't want crowds in restaurants or on Ocean Drive or Espanola Way. We don't want them anywhere, I think, in the county. And that's the challenge. How does a crowd-based economy survive without crowds? But we just can't have them right now. And we certainly can't have them until we have the kinds of tests that are instantaneous, that maybe tell you whether you've had it, that are available all the time, until we have something that allows us to manage crowds and manage the disease in our community. It's a real problem.
How much anger do you get, the sense is out there, of people who are frustrated, want to blame somebody, but also looking because of the economic situation that they're facing and wanting to get back to work, wanting things reopened, willing to take chances that maybe you as an elected official are not willing to take for the community?
I'm getting a lot of negative commentary and a lot of people angry, and I understand that, but I can't, and our commission can't, and our manager can't, and none of us can allow frustration to become the organizing principle of what we do. In other words, we can't say, well, everybody's frustrated, so we're going to not listen to the doctors, and we're going to do something that will have a long-term disastrous impact, but will let at least some people who are angry or frustrated now feel better. We can't do that.
Up next, the fight over voting rights in Florida.